And Saints Joachim and Anna are the patron saints of Springs in the Desert. And so today on their feast day is a really special day for us. And so we would like to pray through their intercession as we begin this time together. In the name of the Father, and of the Son, and of the Holy Spirit, amen. Loving God, we come before you as your beloved children, seeking the help and comfort that only you can provide. The crosses we carry are at times heavy, and sometimes they seem like they are too much for us to bear. Transform our darkness into light, our grief into hope, and open our hearts to your loving presence throughout every aspect of our lives. We pray that through the intercession of Saints Joachim and Anna, the parents of Mary, we will draw closer to you when we feel lost and unsure of where to go. Continue to bless us and our marriages. Walk with us. Give us hope in our present season of life, knowing that you are with us and that you are bringing forth springs of life through our marriages that will bear great fruit in the world. Amen. Saints Anna and Joachim, pray for us. In the name of the Father, and of the Son, and of the Holy Spirit. Amen. Well, once again, we want to thank you for this opportunity to share some time with you. My name is Anne Koshute, and I'm the co-founder of Springs in the Desert. I'll share a little bit more about that in a moment. And I'm here with Cassandra Taylor, who is our social media and design manager. And she put this lovely presentation together for us tonight. And Caroline Gindhart, who is a nurse practitioner not too far away from where I am in central Pennsylvania. And she is a contributor to the Springs in the Desert ministry. So we will be sharing with you tonight some of the fruit of our experience of NFP, and particularly as it relates to the experience of infertility. So I just want to say something brief about Springs in the Desert for those who may not be familiar with who we are. We are a Catholic ministry that is dedicated to providing the spiritual and emotional accompaniment and support to those who are struggling with the cross of infertility. And we want to walk with you wherever you are in that experience. If you are just starting out and finding that you're having difficulty conceiving, if you have been at it for a while, or if you are starting to enter into a new phase of your life, perhaps you are seeing menopause come closer and closer, and you're sort of thinking about, well, what does this mean in my life and in our marriage? And so we want to be there to walk with you. Our focus is on Christ, not on conception. So we want to be that kind of spiritual support and friendship that we need when we are carrying this cross. And we would invite you to go to our website, springsinthedesert.org, to learn more about us and what we have to offer. You can also contact us through our website if you have questions. And please, if you have a prayer request, we really want to bring those to prayer at our weekly team prayer. And just if you need any sort of support, please reach out to us, because it is our honor to walk with you wherever you are on this path. So just a little bit about tonight. We are going to cover kind of three segments in the experience of infertility. Cassandra will start us off just kind of talking a little bit more in depth about that experience of infertility, some of the emotions that we may be dealing with, some of the cultural pressures that we feel, and even some of the pressure that we feel within our own families and even within our parish families. And then Caroline is going to talk a little bit more about infertility and NFP specifically. And she's going to really focus on that importance of having a good, healthy relationship with our bodies, wanting to heal and care for our bodies, and ways that we can communicate with our care providers during those times when charting or treatments and trying to conceive can get really tough. So she's going to have a lot of great sort of insight and information to share with us. And then I'm going to finish us off with talking a little bit more about our marriages and our identity, and looking forward to the many kinds of fruitfulness that can, believe it or not, spring forth from a situation that can sometimes seem very dry and even very hopeless. So before I turn it over to Cassandra, I just want to mention that we understand that there are people who are with us tonight who may be dealing with infertility. This can be a temporary situation. It can be something that ends up, kind of being the shape that your marriage takes. We have all of these different experiences, and we want to honor those. And we know that for those of you who are dealing with it, sometimes it gets very difficult, and this is a sensitive topic. We want you to know that we're here to be uplifting and encouraging and to affirm you. We want you to know that we see you and we understand some of these emotions that you're feeling, because we feel them too on this team. We want you to know that your story matters, that you and your marriage are important and good, and most of all, that God loves you so much, and so do we. So let me turn it over to Cassandra.
Thanks, Anne. Like Anne said, I'm Cassandra Taylor. I'm just going to briefly tell you a little bit about myself so that you know my perspective and where I'm coming from. So I've been married to my husband for almost 6 years. And about 2 years into our marriage, we found out that I had ovarian and uterine cancer. So I had to undergo, over the course of 2 surgeries, a hysterectomy and a bilateral oophorectomy, which is a very fancy way of saying that my fertility in the biological sense is over. And then being a part of this team has been super life-giving for me. And so we just wanted to talk a little bit more about the experience of infertility and define some terms and just talk a little bit more about how we approach it in our ministry and in the work of accompaniment. So the super official definition, according to the CDC, of infertility is not being able to get pregnant after 1 year. So it does define the time limit of 1 year or longer of unprotected sex. For women aged 35 years or older, they will start to consider infertility after about 6 months. I think if we have any healthcare providers listening, and I'm sure Caroline is going to talk about this as well, if you can get someone to listen to you before these timeframes, that's obviously a good thing. And that's, one of the benefits of charting an NFP, that you can start to uncover some diagnoses before it's too late. But I also wanted to highlight this data of how common infertility actually is, because it's such a silent suffering. We don't hear about it a lot. I mean, at Springs in the Desert, we hear about it all the time because we're the ones talking about it. But 1 in 5 women, heterosexual women aged 15 to 49 years old, 1 in 5 are unable to get pregnant after 1 year of trying. That's a lot of women. And these, women and couples are in our families and in our friend groups. And most importantly for tonight, they're in our pews. So that's why we're constantly advocating for greater visibility for this topic in the church. Infertility breaks down into kind of 3 major categories, at least from our perspective. There's primary infertility, which most commonly refers to those couples who have never conceived. Secondary infertility may have, 1 or even more than 1 living child, and they're experiencing, that period of being unable to conceive. And there's also women and couples in our community who are suffering pregnancy loss. This loss may be recurrent, usually in conjunction, with infertility. So they see, they're struggling with this, right? Not having a living child and having this grief that can be so hard to explain. So we are walking with those couples as well. Women and families in our community with and without a diagnosis, people in menopause who are post-hysterectomy, couples dealing with male factor infertility, and more. Everyone's infertility story is unique to them. But these are the major categories that we break down in terms of how we're accompanying our people. At Springs in the Desert, we've developed 3 stages along the path of infertility that we like to talk about, because these 3 stages require and benefit from different types of accompaniment. The couple who is maybe just setting out on this path is seeking out infertility resources for perhaps the first time. They're not really sure what's going on. Does this apply to them? Does it not apply to them? Perhaps they're discerning whether or not to start pursuing more intensive treatment. Couples on the path are perhaps in the midst, and they're really in intensive healthcare treatments, taking the handfuls of supplements and injecting themselves, having 1 or more surgeries, perhaps even coming to a point where they're discerning whether or not they need to take a break and step away from all this treatment, because it does get to be too much. We're going to talk about this a little bit more later, but the stress of all those appointments and scheduled intercourse and all this can really start to weigh down on a marriage when the desired result is not appearing. Couples who are perhaps approaching new horizons are starting to look beyond infertility as a kind of limiting factor. And we always encourage people to see the opportunities for fruitfulness that God is putting in their life, because we're all, each and every one of us, called to that fruitfulness. So this can look like acceptance. Acceptance doesn't have to be something that comes at the very end of the road after you've gone through all of this other stuff. And also, these stages might not, in your experience, be linear. Sometimes we're on the path. Sometimes we're moving a little bit closer to new horizons, where we're trying to look out and see what comes next and make peace with our situation. And sometimes we're starting all over again. So if you go to our website, springsinthedesert.org, you'll see different content directed more at these different stages on the path of infertility, because they are unique and require different types of accompaniment. We just also wanted to take some time to affirm those multifaceted challenges of infertility, because a lot of the times it seems we're at a loss for words of explaining why, in fact, infertility is so hard. So just to break it down, the couple, and especially the Catholic couple struggling with infertility, is longing to witness to that love they have for their spouse and their love for God and their openness to life. They are longing to witness that way, and perhaps it's not working out in the way that they so deeply desire. You know, as Catholics, we value life from conception. We long to witness to that in this culture of death that we're all living in. But instead, we find ourselves kind of accidentally living this child-free lifestyle. If you've come across that on social media, proponents of, not having children as a type of freedom, like a choice that you make. And we find ourselves, not associating ourselves with that camp, but kind of realizing some of the silver linings of that lifestyle. But some of us feel guilty about that. We hear from women who feel guilty that they can take a vacation because they feel like they shouldn't be able to, because they should have children. And there's a lot of internal pressure. Why am I going to enjoy this vacation when I really should be doing something else? When really the vacation, the ability to go on a vacation, is a gift from God. But of course, with infertility, we get into this confusion. Also, maybe many of us on this call, I know I've experienced personally pressure from healthcare providers and others to pursue artificial reproductive technologies that go against our Catholic faith. My first meeting with my oncologist, who I get along with so well, and I, love him and respect him as much as you can, love and respect your gynecologic oncologist. But anyway, the first time I met him, I'm in the room, it's me, it's my husband and my mom. And we were living in Spain at the time. So we came home, really quickly to Connecticut to see if I could see someone over here. So it was my first time meeting him. We had an idea it might be cancer. And I'm explaining to him, because we didn't know what was going on, that we wanted to have children. And he says, just very offhand, you could always get a surrogate. And, this is the first meeting. So we're kind of like, laughing it off because that's what you do, right? But I'm sure I'm not the only person who has had to defend, our Catholic faith and beliefs from the exam table when you're already in such a position of vulnerability. And then this pressure is put on you as well, and you find yourself evangelizing from the table. We also come up against pressures in the church. A lot of times these are pressures that are almost at times imaginary, not always, but we feel like there is a pressure that exists to have a good Catholic family. A lot of us have had that deep desire to, fill the pew. I mean, my family takes up basically an entire pew, and we have this idea that that's just what's going to happen. And when it doesn't happen, it's a deep suffering. We're afraid of being judged by other people in our parishes and in the Catholic community for contracepting, when of course that's not what we're doing, but because it's uncomfortable to talk about infertility, maybe people don't know about our struggle. And so we're afraid of what they think, even if they don't say anything. We're going to talk about the comments people make in a minute, but even if people don't say anything, we feel that pressure. And there's also a deep feeling of isolation. Sometimes we don't know where we belong in our parish. We don't really belong with the young adults. We don't really belong with the parents. Sometimes the parish doesn't know where we belong. And it's even further isolating than the cross of infertility is already. Infertility presents physical and medical challenges, as I was saying about the surgeries and the treatments and all the doctors, and even trying to access a Catholic healthcare provider can be a huge challenge. The challenges of infertility are mental and emotional. There is a unique grief that comes with infertility that can be very hard to explain, especially when a lot of us don't believe we have a right to be grieving at all, which is not true. This is a loss that we've suffered, but a lot of times, especially in the case of, primary and secondary infertility, with pregnancy loss, that it's a tangible loss. That is a specific person who is in our life who has passed away. But on the other side, it's, the loss of this deep desire, our vision of what our entire life and vocation was going to be about. And a lot of times those children to us feel very real, so it is a loss. It's a real loss. And that grief deserves to be processed and grieved properly. And I'm going to take this time to give our disclaimer that we always encourage you to seek professional counseling or spiritual direction, whatever your situation demands. If those feelings are too much to bear, you have permission to do that. The challenges of infertility are spiritual. We begin to experience difficulty in our prayer life, difficulty in our relationship with God, which I'm going to talk about more in a minute, and relational with our own selves, our bodies, our spouses, our families, our friends, our doctors, and with God. We start with ourselves. We start to believe these lies about ourselves that come out of this suffering that we're dealing with infertility. I wouldn't have been a good mother anyway. We wouldn't have been good parents. We don't deserve to be parents because maybe you did some things in your past you're not proud of, and I'm being punished for that. There are all kinds of thoughts that are lies from the devil that we start to believe because we don't understand why we're not being given this gift. That's such a good thing. And the desire is good. But because we don't understand, we start to get confused. Also, our relationship and perception with our bodies can change throughout life. The cycle comes and we're disappointed that it's come because it means we haven't conceived that cycle. But then as we get older and the period doesn't come anymore, then we're disappointed because it's gone and because that door is closed. And it is a strange thing for me to see my sister's feminine products. And I remember coming home from Spain and packing up my feminine products and not knowing if I would ever need them again. And I didn't. And that's a loss. We're also dealing with the different societal views of the menstrual period. There's a perception that comes from society that the period is dirty or it's a curse, or that a man couldn't handle it and it's a negative thing, then I see maybe less so, but also there's this kind of like fertility goddess thing going on with our periods. Sometimes we want to celebrate the period, but the truth, at least in my perspective, is that the truth is somewhere in between, right? The cycle is a sign of our own health. It's been spoken of as a fifth vital sign, and we can learn to appreciate it, those of us who still have cycles, which I do not, as a marker of our own health. And in case there's anyone watching this now who happens to have daughters or people out there in the church watching later on, we just wanted to take a second to recommend these two programs from these friends of ours. The first one is Cycle Prep from Christina Valenzuela, who's a fellow OSB Challenge finalist with us. And she's actually a member of the Archdiocese of Boston as well. And she has her Cycle Prep program at pearlandthistle.com. And our friends over at the Archdiocese of St. Louis Natural Family Planning Office have their own program called The Wonder of Eve. And these programs are period education programs that are designed to raise girls up with a healthy understanding of their cycles, appreciation of the cycle as a sign of our own health, and not just for fertility purposes or other purposes. So we definitely recommend checking those out. Infertility's impact on our relationship with our spouse cannot be understated. Our marriages are under a lot of pressure that are coming from trying to conceive. We're also processing grief in different ways. I know that I process grief a lot differently from my husband, and then I don't understand why isn't he grieving when he is grieving, but just in his own way. This, of course, can lead to communication issues and also conflicts when couples have different opinions on treatment and next steps to take. And all of that has to be discerned, carefully and ideally with guidance from a priest. It impacts our relationships with family and friends as we feel that pressure from other people's expectations, the pressure to perhaps give your parents a grandchild, and also their very valid sadness for what you're going through. I know my mom says that, she can't understand, not that she doesn't have empathy, but because she hasn't gone through what I'm going through, I think she suffers for that because she has not experienced that herself. So our family's emotions around this that we're going through can be a challenge for us. It doesn't mean that their emotions aren't valid, but it can weigh heavily on us. And especially when we have to deal with insensitive questions or remarks, whether the person is, trying. I mean, I think most people are not trying to be offensive, but people say all kinds of things that we don't need to go into, but I'm sure a lot of us have heard something. And then there's that feeling of being left out or left behind, and that isolation again that we experience. I know a lot of my friends are, having baby number 2, and that me and my husband are off on this kind of different path, and it's God's path for us. So it's the best path for us to be on, hopefully, but it doesn't mean that it's not lonely. Infertility obviously impacts our relationship with our healthcare providers. We're a lot of the time placed in a position of having to advocate for ourselves. If you're like me and your first instinct is to just roll over and die, then that's probably a really uncomfortable position for you to be in. A lot of us aren't used to that, to having to push back against the professional. Caroline's going to talk a lot about this in a minute. And of course, it's also a challenge when the healthcare provider doesn't share your same faith values. Finally, and most importantly, our relationship with God can come under a lot of strain because of this cross, because we feel like we so desire something that is good, something that we've been raised to believe would happen so easily, but something that is a complete and total gift that can be very hard to understand, especially at first, why it's not being given. We have feelings of being punished or abandoned by God, that he doesn't have good things in store, that our marriage isn't blessed, that we married the wrong person, or that even that, your spouse should be without you. I've had this thought before. If my husband, or if I died, or if my cancer came back and I died, then my husband could have children with someone else. These are not helpful thoughts, and they're not from God. This, in fact, is an invitation to grow closer to Christ through suffering. And again, spiritual direction in this case can be invaluable. So just for all of these reasons and these multifaceted challenges that we've just touched on, just to kind of affirm the experience of those people on this call who are also carrying this cross, it's so important when we're dealing with our healthcare providers and for NAPRO doctors, et cetera, to have this holistic mindset that this cross is physical and medical, but it's also emotional and mental and spiritual, and that it has to be dealt with in a holistic way. So I'm going to pass it over to Caroline to talk a little more about those things.
Yeah, thank you, Cassandra. So my name is Caroline. I am a nurse practitioner at Divine Mercy Women's Health in central Pennsylvania. So I went to, just a little bit about me, I went to Penn State University for nursing school and nurse practitioner school. And after I graduated from Penn State, I went for training at the St. Paul VI Institute in Omaha, Nebraska, to learn to teach couples the Creighton model of natural family planning and to treat women's health issues, including infertility, with NAPRO technology. If you've never heard of NAPRO technology, it stands for Natural Productive Technology. It was developed by Dr. Hilgers probably about 30 years ago. So he helped to develop the Creighton model system of natural family planning built on the Billings ovulation model. And when he was treating these women who had infertility, he saw a lot of similarities in their Creighton model chart and started to identify biomarkers in their chart, which we'll talk a little bit about, things that were just recurring. And he started to do medical and surgical workups and began to find the underlying causes of infertility and treat them in a way that cooperates with our body. So that's the way that I approach infertility. That infertility is a symptom of an underlying disease. It's not a disease in and of itself. So as a medical provider, I seek to find the various causes, and it is usually very multifaceted. The different causes are contributors to infertility, and I treat them in a way that with the body. So it doesn't invent like in vitro fertilization would, where it just ignores all of the underlying issues to create life. But NAPRO looks to find those issues and correct it and work with the body. And it supports the dignity and the sacredness of marriage and the couple and the sexual act. So it is in accord with Catholic teaching. So I get a lot of patients who are Catholic. Some are Christian, some are atheist. And you don't have to be Catholic to use this. So when we're talking about natural family planning, it has many positive effects. So it can help improve our relationship with our bodies. So natural family planning is a unique language. Now, there are many different methods of natural family planning. I teach the Creighton model. That's the perspective from which I diagnose and treat patients. But I also treat patients who chart with the Marquette method, which is measuring urinary metabolites like luteinizing hormone. The Creighton model, Billings ovulation method, you chart your cervical mucus. And then there's the symptothermal methods that do a little bit of charting cervical mucus, but also basal body temperature. And so these are these physical signs that our body is showing us to tell us when we're fertile and we're not. And as our fertility goes through waves. We're not fertile all the time like men are. And so we have hormones that go up and down throughout the cycle, and that affects all of us. It affects our mind, it affects our emotions, our well-being. And so when we know those times in the cycle where we're fertile or not, and we're having different symptoms based on where we are in the cycle, that can help us understand our bodies better. We are not, souls inside of bodies or anything like that. We are body and soul. So what we do with our body, we do with our soul, and vice versa. There's not this separation. It's all completely joined. We're compartmentalized. So it can, when we're understanding our body, that can help to better understand our mind and our heart and our soul, and improve that relationship with ourselves. And instead of, saying, oh, I shouldn't feel those emotions at this time, maybe it's premenstrual syndrome, PMS, carb cravings, more irritable, more short, more emotional, instead of saying, no, why am I feeling that way? No, like the PMS is a symptom of something underlying, and it happens right before we get our periods. And so instead of, putting those emotions away, recognizing them and saying, no, that there's something going on, there's a reason I am feeling this way, and it's because I am in this part of my cycle. So it can improve our relationship with our body. When I am treating a couple, I have two main goals. I want to optimize health and optimize fertility, because like I said in the beginning, infertility is a symptom of an underlying disease. So there are underlying issues that can affect our long-term health. And so I want to correct those, and that is going optimize our fertility. For example, polycystic ovarian syndrome. There's many different presentations. There's no one size fits all of polycystic ovarian syndrome, where women have irregular cycles, might have acne, weight gain, abnormal hair growth. If it's not treated, the long-term progression of polycystic ovarian syndrome is diabetes, increases your risk of endometrial cancer, heart disease. So by treating that condition, it's helping to prevent those long-term complications, and it's going to optimize fertility. And it's something that if you go to your run-of-the-mill OBGYN and you have polycystic ovarian syndrome, you're put on the birth control pill as the only option. And I've had so many patients who come to me and say, my doctor, they diagnosed me with PCOS. They said, you need to go on the birth control pill. And if they didn't want to do that, then the doctor was like, well, then I cannot help you. And that's unfortunate. Like, that is not how women deserve to be treated. We deserve to be understood. There's no other area of medicine where, there's kind of just a one treatment for any presentation that you have, whether it's menstrual cramps or heavy bleeding or PMS or acne. And so, we're talking about, trying to conceive, but a lot of us, if to conceive now, we had these signs when we were in our teenage years. We probably went to our family doctor or pediatrician or OBGYN and saying, I have really heavy, painful periods. And instead of looking to see what was caused painful, heavy periods, we were put on the birth control pill, and maybe we didn't go on it, and then we weren't on any help. And we've been suffering since we were teenagers. So it's unfortunate, that's the way that mainstream medicine is. And so, when you're charting your cycles, it can help to uncover diagnosis. That's what I was talking about, biomarkers. When I look at a Creighton model chart, it's language that a patient speaks, is interpreting her body signs and treating it. And I know what those signs mean. She can have brown bleeding at the end of her period. She might not have good quality mucus. She might have short luteal phases. And when I see those things, that helps guide me into how I'm going to try to diagnose and treat a condition. And so, as well as using natural family planning to achieve pregnancy, avoid pregnancy, it can also uncover other diagnoses. And so it's showing that there's a value of our own health outside of our fertility goals. Again, I want to optimize health and optimize fertility, and our bodies are beautifully and wonderfully made. And so God wants us to take care of them. So that's a command from him to take care of ourselves. And so there's both benefits and challenges of charting. And I think that sometimes we can only look at the benefits, but there are struggles with charting as well. So as far as positive aspects, number one, it can increase communication between spouses. When I am teaching couples how to chart their cycles, I talk a lot about mindfulness, which is really about living in the present moment. And when you're charting cycles, different emotions can come up across the different part of your cycle. And Cassandra talked a little bit about this. When we get our period, feeling that that grief that we weren't pregnant that cycle, and so identifying that, or when recognizing signs of fertility, feeling pressure during that time to perform, like, okay, this is the only time in the cycle I can get pregnant, so we have to have sex right now. And you have intercourse during that time, and then you go into the post-ovulatory phase, and you feel that intention of just waiting until that day I can take that positive pregnancy test. And so, looking at your chart, I always say it's good to dive at the end of the day. And when you're feeling these emotions, well up inside of you, like that pressure to perform during the fertile time, and you're those white baby stamps and create my white baby stamps to show, fertility, saying, I feel, I really want to show my love for you right now, but I'm feeling a pressure to perform, and just verbalizing that with your spouse. And so I chart as a way to communicate how we're feeling, because it shows in bright colored stamps exactly where we are in our cycle. And again, it can help to uncover other health issues, some of those biomarkers that I was talking about. So those are the positive aspects of charting. But there are many challenges to chart too. So, like I just talked about, it's scheduled intimacy. So sex can just feel like a chore, because as women, we're not fertile the entire cycle. So there is only a window where we can, pregnant. And so, we in biology, we learn that sex is for two purposes. It's for procreation, so for bonding. And sometimes we can be so focused on that we forget that God also made sex for bonding, to bind us to our spouses, to increase communication and trust. And that's one expression. It's our wedding vows made flesh, those wedding vows that we say, I'm going to love you until death do us part, in sickness and in health. The active is those words, made into flesh. And so it's beautiful and sacred, and it's meant to bind us to our spouse. And that aspect of it, we can sometimes forget, because we have such a good, beautiful, holy desire to become pregnant. And then we can also feel like my body is broken, like when I teach the Creighton model intro sessions, we show, what your cycle look like. And I tell the women, I'm like, cycle like this, like no one's chart like what is on the screen. But we have the standard of, this is what my chart should look like, and mine looks nothing like this. And, our bodies were it's stamped into our being that, as male and female, they're made to bring forth life. And so it can, like, my body isn't doing what it's created to do, and it's broken. And in our identity, whenever
Caroline, can I stop you for just a quick second? Can you hear me?
Yeah.
I'm wondering if you turn your video off. I know it's not ideal, but maybe if you turn your video off, the audio will come in a little bit clearer.
Yeah, I can do that. See. Okay. Is that any better?
Yeah, it sounds good to me.
Okay. So, we can start to identify ourselves with infertility. When I'm talking to any patient, I never, call a patient with a diabetes a diabetic patient. Their identity is not diabetes. And the same goes with infertility. I never say, you're an infertile person. That is not true. That is not You are a woman or a man who suffers with infertility. And so that does not define you. Yes, that's something that you're going through, but that's not your identity. And, it can also be difficult when you're charting. It can just feel so repetitive month after month after month. If you're not becoming pregnant, feeling like you're doing everything. I'm taking all of these medications. I'm taking all of these supplements. I'm eating a diet that I hate. I'm not eating, and every diet or supplements or treatment is different. But as an example, I can't eat dairy, I can't eat gluten, I can't eat sweets, and just feeling like month after month I'm putting, I'm having intercourse at the right times and taking all of my hormones and just not seeing any results. And that can just get exhausting. And so then the last thing that you want to do is to chart, is to have a reminder of month after month, where you are in your cycle, because it's something that you experience every single day. Every single day, you're observing your fertile signs, you're putting it on the chart, you're taking medication. So it's a constant reminder of the fact that you're struggling with infertility. And then there's also the danger of objectification, your spouse is a gift from God, and a child is a gift from God too. But sometimes we can be so hyper on becoming pregnant, we forget that a child is a gift from God. It's not a commodity that can be bought or sold, or something that should be put on a pedestal. I want to affirm the good, holy, beautiful desire for children. God put that into us. But sometimes we can fall elevate it as the most important thing. And it can, create that as an object to be used instead of gift that is freely given from God. And so, couples, might start to wonder, I've been doing this month after month after month, and I'm not seeing any results. When we talk about effectiveness of NAPRO technology, not to be all technical, but we say, up to 8% of couples can become pregnant with NAPRO technology and surgical treatment, but different based on, the different causes of infertility, your age, it varies, so it's not as 100% effective. And so you might be going this for, months and years. It wears on us, body, mind, and soul, that month after month treatment. And so you might start to wonder, when is enough? And so I like to talk to my couples about discernment. And what discernment is choosing two goods. It's not discernment if you're choosing between a good and a bad, and it's obvious what we should choose. We should always choose the good. But when we're choosing whether to continue treatment, which is a good, to desire and to help, bring forth a child, that is a good desire. It's a good choice. But it's also a good desire and a good choice to say, right now, my mental health is struggling, or my emotional health is struggling. My relationship with my husband is struggling. And I want to focus on that, maybe by taking a total break from treatment and saying, I'm going to stop the medications, the supplements that I don't necessarily need right now. Or I'm going to, take time and go to therapy, or, just work on my relationship with my spouse. And, it can be a temporary break too. I need 3 months to just step away from all of this treatment. That is a good decision. That is a good decision to say, that I am not doing well mentally, emotionally, physically, whatever it is, and I need to take a step back. So that is choosing between two goods, and that is a good discernment. And so don't ever be afraid that if you're deciding to stop treatment altogether or to take a step back, don't ever feel like you're giving up hope. That is the farthest thing from the truth. I tell my patients, I am so proud of them when they make that difficult decision, because it's something that they desire so much. And so I know that decision comes with a lot of weight to decide to step back from treatment. And so I applaud my patients who recognize that the treatment process in some way, which should at the end of the day, should be healing to your body, mind, heart, and soul. When they recognize that that treatment is not healing to them and that they need to step back. I admire them so much for making that brave choice. So it's always important to, you discern with your spouse and with God, to always, and it can, and Cassandra talked about this too, that so many people around us have so many opinions, whether it's your mom, your brothers, your sisters, your friends, your hairdresser, like everyone like tells you like something different. And, oh, have you heard about this? Or, why don't you do this? And in the end, they have no idea. Discernment is between you, your spouse, and God. The three of you, that's what makes up your marriage. And the three of you know what is best for you. And so I know it can be so hard to not get down from, what the people around you are saying. But in the end, it's between you, your spouse, and God. And so, it can be really difficult to communicate with your healthcare provider, especially if you have decided to take a step back from treatment, or maybe you're not going to a Catholic practice and your healthcare provider is recommending things that are against your faith, in vitro fertilization or intrauterine insemination, or even the way that you collect like a sperm analysis. It can be against the Catholic faith. And so ideally what should happen in the patient-provider relationship is a patient should feel heard and listened to and not dismissed or ignored. So when I start out in my first appointment with a patient, I sit and I listen. I want to hear what their journey has been thus far, and then I ask questions to better figure out, what is going on. But I tell them from the beginning, this relationship is not me trying to dictate a treatment plan. This is a relationship between us where I'm going things and I'm going recommendations, but I will always give a patient multiple choices about what they can do. And I want to hear what they think about the plan that I'm coming up. And so it's really about empowering the patient to be in the driver's seat and to go whatever speed that you want to. You might start out wanting to be very aggressive. You might to start out being more slow. And that's, so in an ideal world, I should be constantly communicating that with you to know where you are in your desires, about how aggressive you want to be, the things you're okay with, the things you're not okay with. And my support should be from a holistic nature. Like, yes, like both goals to have you become pregnant. But that is not my only goal. If I just treated your body, then that would be a disservice to you, because we're body, mind, heart, and soul. So my treatment should be aimed at all of those aspects of your person, because that is everything that makes you up. So I shouldn't just be focusing on healing your body. Yes, that's my main desire, but the treatment should also be healing to your mind, should be healing to your soul. And so that in an ideal world is what a patient relationship should look like, but it doesn't always end up that way. And so if that isn't the case, don't be afraid to advocate for yourself. And that can be difficult because as a patient, you may feel like, he or she went to school for this, and they know a lot more about it than me. But in the end, I don't know any about yourself like you do. You know yourself better than I do. And so to advocate for yourself can be difficult, especially, if that relationship isn't such the provider is open to hearing about what you think about the plan. And so some practical tips because it can be hard to bring up this question, especially if it isn't an environment where you feel comfortable bringing up questions. So some questions that can just kind of open the door to having this conversation are, what do you see as the next steps in treatment? And what is the timeline for this? or say something like, I'm struggling with how many pills I'm taking. Do you think there are any I could stop? Or, this diet is very restrictive and I enjoy food. What do you think I could add back in? Sometimes you might not even know why you're taking X, Y, and Z supplements. So ask, why am I taking X, Y, and Z? And that can open it up to, actually, you don't need to be taking this. You could probably stop it. Or saying, treatment is causing me a lot of anxiety or affecting my relationship with my spouse, etc. If I took a break from treatment, what would that look like? So those can be very scary questions to ask, but I encourage you to be not afraid to ask those questions, because at the end of the day, it is your life, and this is your journey. And my job as a healthcare provider is to assist you in your plan and your desires for your life. And just again, to reiterate, it is not giving up if you've discerned a change in treatment plan or to take a break. You've made a good judgment that right now it's just not best for you and your spouse to continue to do this treatment month after month. And two, you might not have a good fit with your provider, and that is completely fun. We all have different personalities, and different personalities mesh. Just like, I'm friends with certain people and I'm not friends with certain people, not because they're bad people. People are at their core good, but because of my personality and my life experiences, being friends with someone might be what's best for me. The same goes for your medical provider. You might not have a good relationship with them, or might not feel heard. So that would be a good time to, especially if you bring up these concerns and you still do not feel like you're being listened to, it is not, giving up or worry about our feelings. Like, go and find a new provider. I've had patients in my office that particularly don't like my style of treatment. So they'll switch to the other nurse practitioner in the office, and vice versa. And that is completely fine, because again, I want you to receive the care that you desire. So don't ever feel like you're offending your provider. Decide that it's not a good fit. That is, a good choice. And I would applaud you for advocating for yourself again. And so we're going to move into Anne's part here. But something that we use in the Creighton model is called the SPICE index. So if you chart with the Creighton model, you're very familiar with this little fun acronym here. But the way that we use it in the Creighton model is that it's usually thought of for couples who are using the system to avoid pregnancy when, they're avoiding intercourse during the fertile time, saying that intercourse, the act of sexual intercourse, isn't the only way that we express our tenderness and affection for our spouse. Pope John Paul II, in his encyclical Familiaris Consortio, said that tenderness and affection are what constitute the inner soul of human sexuality. He didn't say sex is what constitutes the inner soul of human sexuality. It's tenderness and affection. So we can express our tenderness and affection for our spouse through all of these ways: spiritual ways, physical, intellectual, creative, and emotional. And so this isn't just for couples who are using the system to avoid pregnancy. Even more so, it's important when we're struggling with infertility, because we can become so hyper-focused on having intercourse because we want to become pregnant that we forget that we are sexual beings with all of these different aspects to us, these spiritual, physical, intellectual, creative, and emotional aspects. And so Anne next is going to just talk a little bit more about that.
Thank you, Caroline. Thanks so much for everything you said, and Cassandra as well. And a lot of what they said will sound very familiar in how I want to try to tie together this idea of our marriages and our identity and fruitfulness when we are in a season of infertility, whether that's a temporary season or it's something that is more long-lasting, for example, as it is in my case. So I want to pick up on what Caroline said about the SPICE index. Before I do that, as I was thinking this through, okay, like I'm an Instagram scroller. So, I go through, and then somebody on our team, I won't say that it was Cassandra, turned me onto these reels. And so now, I'm watching this stuff and I'm getting all these tips on, what to buy at Target and how to make Mediterranean salads and all that kind of stuff, right? But one of the things that we might notice when we're especially on social media is this trend toward body positivity. And I think there's a lot of good to that. I think that in many ways that can be sort of a healthy reorientation, that we're not just sort of down on our bodies. But I think it's incomplete. And it can also lead to really sort of negative thoughts about our bodies. We can reduce our bodies to parts. My stomach is too flabby. My nose is too big. I don't like my hair color. My metabolism is slow. All of these kinds of things. And so we can really reduce ourselves to just these parts, or our functions, what works or doesn't work in our bodies. And then rather than seeing them as something positive, we can almost see our bodies as machines, and we want to manipulate them or make them do what we want them to, or not do what we don't want them to. And so the way that I've been sort of thinking this through is that it's not so much body positivity that we need to focus on, but rather whole person positivity. Because as Caroline mentioned, we are a unity of body and soul. And so our dignity and worth doesn't come from an Instagram influencer, or we don't get validation from, 25 likes on a post. Our dignity, our worth, and most importantly, our identity come from one source. And that is this truth that we are made in the image and likeness of God, and that each one of us is loved by him so deeply as his daughters and his sons. So that idea of whole person positivity, I think, is a helpful way to sort of reframe our thinking in a way, especially as we look at this experience of infertility. So I want to pick up again on Caroline's explanation of spice, but I want to do kind of spice with a twist. And the fact that regardless of our fertility or the discernment that we might be in around our fertility, we have to nurture our marriages. Marriage is hard, no matter what, whether it's infertility or anything else. I mean, there are struggles that are a part of marriage. And so it's important for us, wherever we are, however long we've been married, whether we're newlyweds or we've been at it for 50 years, we must nurture our marriages. And so I think that these principles behind spice can be really helpful just generally, but in particular with this infertility walk. And so I want to go through the spiritual, physical, intellectual, creative, and emotional, and kind of make that tie with infertility. So in terms of the spiritual, when we are in a season of infertility, as it's already been mentioned, we can get worn out by charting and treatments. And that not only has a physical or emotional effect, but it has a deeply spiritual effect. It can make our relationship with God really difficult. It can make it even non-existent. I mean, we can push him away, or we can just simply feel at a loss for words. Here I am, I'm trying to be a good and faithful servant, and this isn't happening. Like, what's happening? I don't even know what to say. I don't even know how to pray to God. Or perhaps I don't even feel like talking to him. And it can seem like we have nothing to be grateful for. I mean, we talk about the importance of being thankful for our spouse, thankful for the things that we have. But sometimes when we're in this struggle and we're really suffering, it can be hard to find even the simplest thing to be thankful for. Or we may see those things and we may just kind of cross our arms and say, no, I am suffering and I'm not going to be thankful. And then perhaps praying with our spouse is a non-starter. We may not pray with them because we don't want to be that vulnerable, or we don't know how to invite them into prayer. Or maybe our relationship with God is just so strained right now that we are just bottling everything up. And just the subject of spirituality in general is something that we can't deal with. So how can we kind of turn that around? What are some maybe practical ways that we can address the spiritual aspect? Well, it's important to cultivate a personal prayer life. Easier said than done, but it can be really simple. Say the good, right? Ask for the things that you need. Be thankful for what God is giving you. I mean, if you can't think of anything else, be thankful for your spouse. Be thankful for the sunshine or for your garden or any little things. But don't leave out the bad. I always like to say that our God is a big God and he can handle it. And he wants to hear your suffering. He even wants to hear when you're mad at him. Now, I'm going to clue you in on a little known theological fact, but God already knows, right? God already knows how you feel, what your emotions are, what you're going through. But he wants you to be able to let it all out. He wants you to give it to him. So it may take time. It will definitely take some patience, and it will take some just maybe a force of your will and being consistent. And even if it's only something really short, and it can be as simple as, God, I don't know what to pray. You know what's best. Help me out today. Invite your spouse to pray. You know that praying with another person, and especially with our husband or our wife, is an incredibly intimate experience. And it can really draw us closer, and it can really forge a bond. And it's an opportunity for us to be truly vulnerable, because sometimes in prayer, that's when we sort of reveal our struggles or what we need most. So invite your spouse to pray. Again, keep it really simple. If you need to do an Our Father, Hail Mary, Glory be, and that's it, go for it. If praying before meals is the way that you want to start, do that, but just begin. Go to church. Go to church every week. Go to church together if you can. And don't forget confession. When I have been away from confession, I try to go monthly. If it's been longer than that, I can always tell by my relationship with my husband. When I start to just, fall into those patterns that I know so well, when I get that grace to have that presence of mind to step back, I say, oh, I need to get to confession. So confession really is so good, and it gives us that grace that we need. So confession and Eucharist, we need that grace. That's like our fuel. That's what animates us and truly gives us life and helps us to do what we need to do, and helps us to nurture our marriages. And then pray about infertility. Of course, please, if you're trying, pray for that gift of a child, but be also open to those unexpected but beautiful responses that God may be giving you. We hear oftentimes about praying for our miracle. And if we don't get pregnant, we think, well, then God has no miracles for us. But it's a miracle that you are married, that you have this spouse, that you have this life together. And there are so many miracles all around us, but we can get so hyper-focused, as Caroline mentioned, that we miss all of them. So don't miss out on all of that beauty and those miracles. The next letter on the SPICE index is P, which stands for physical. And it's already been fleshed out by both Cassandra and Caroline that intimacy can be a struggle when you're dealing with infertility. Scheduling sex can make it feel like it's not fun, it's not spontaneous. We can feel like we're not really enjoying each other or able to fully give ourselves to each other, because we're sort of viewing it like a job, like a task that we have to complete within a certain time frame. We may fixate on what's wrong with our bodies. Again, back to that whole person positivity, right? We may just fixate on my body's wrong. Something's wrong with my body. It's broken. It needs to be fixed. And so we can become overly critical of ourselves or our spouses. And then, as Caroline mentioned, there is that danger of objectifying ourselves and our spouses. We can sort of lose sight of the gift that our spouses, I'll never forget the time that, my husband looked at me and said, "Am I not enough for you?" And that was like a real wake up call for me to say, I am focusing too much on my body, on treatment, on getting pregnant, and forgetting this beautiful gift. I married a man, a person. I married my Keith. I didn't marry some ideal or some way of self-actualization. So how do we sort of counteract that negative physical outlook? Well, talk to each other, open up about your feelings. As Cassandra mentioned, men and women process things differently, just in general, and especially something like infertility and the grief that can come along with it. That male-female dynamic really comes into play. And so it's easy for us to kind of make assumptions about each other. So open up to each other. It can be hard because it is vulnerable. It's a vulnerable place. But talk about how you're feeling so that you can work through it together. Infertility is not a one-sided kind of issue. It's something that a married couple is dealing with together. Again, care for your bodies, do something, find something that you can do together. My husband is never going to eat quinoa and avocados and things like that, but he will go on hikes with me. So that's a way we can take care of our bodies together. And it's time we spend together, and that nurtures our marriage. Again, learn to love and appreciate your body, not based on what it can or can't do, but on the fact that you're made in God's image and likeness. Love and affirm your spouse and your spouse's body. And as Caroline mentioned, talk to your provider and reevaluate your care plan whenever you need to. Okay, the next letter is I for intellectual. And again, trying to conceive can become all-consuming. It can just populate all of our thoughts. And 9 times out of 10, those thoughts are super negative. Fertility or infertility can also become a really intellectual kind of pursuit. It's scientific. Well, scientists have worked on this, so we have some kind of control over it. And if I only sort of manage my body and my diet and the pills and the surgeries, we can fix this. And again, we can just sort of objectify ourselves and think, if we think it through in just the right way, the problem will be solved. And then, of course, our thoughts can turn negative. And I'll talk a little bit more about that in a moment. Cassandra touched on it as well, which, of course, leads to additional stress and anxiety. And all that does is put pressure on our marriage that it certainly does not need. So how do we sort of combat that over-intellectualization or those thoughts? Nurturing your marriage in all seasons. It's not just for these intense or crisis periods of time. Pursue your own interests or new interests. It's okay for you to have a hobby that is yours. And that's healthy and that's life-giving to you. But it's also an opportunity to invite your spouse to discover new things. Hey, this is my new hobby, or this is my interest. Let me tell you about it. And together you can really discover new and wonderful things about each other, and maybe learn to love something that your spouse is interested in that you wouldn't have otherwise thought you would be. Give yourselves permission to enjoy each other and to enjoy life. Again, Cassandra mentioned that it's okay to go on a vacation or to have that time alone just to kind of be together. Don't feel guilty about that. That's what you're supposed to do. If you become so kind of insular and self-centered that you don't care about the rest of the world, then that's not healthy, and that's not the meaning of marriage. But to really care about each other and be for each other is something that is good and healthy. And then finally, on this one, I would say do a periodic social media cleanse. Take a look at the people that you are following, or even perhaps maybe friends or family members. So if you have just received a diagnosis, or Maybe you've just received another negative pregnancy test and it's a hard time for you. And you know people in your friend circle who have just gotten pregnant. It's okay to mute them. You don't have to unfriend anybody, but it's okay to just mute those posts for a period of time so that you can process that. But I would encourage you not to just go around muting people or avoiding them. We need to create boundaries. It's important for us to know that we don't need to share our entire life and our story with everyone, but we shouldn't build walls. And so if you have a friend who is pregnant right now, for example, talk to her and share that you love her and that you are happy for her, but it's hard for you right now because of the season of infertility that you are in. And 9 times out of 10, she is going to thank you for coming to her because she didn't know how to go to you so that she could support you. And if there are Facebook groups or things that no longer serve you, even if they are infertility support groups, not Springs in the Desert, of course, I'm kidding. But if there are those kinds of groups and they're no longer serving you, then it's okay to let those go. So think about a social media cleanse. I do one during Lent. Perhaps you want to do it every Sunday. You just put the social media away, or even just one day a month. And it may be hard at first, but you will, I think, be pleasantly surprised at how much healthier you feel and how it opens up your ability to have these conversations and have fun and utilize your time in ways that you didn't realize you were missing out on. So the next one is emotional. And I realize that you might be saying, Anne, you don't know how to spell. But I'm putting these last 2 out of order because I want to do creative last. So again, as we've talked about, communication when we're dealing with infertility can be awkward or it can break down. We can make assumptions about each other, especially in that male-female dynamic. He doesn't express the way that I do, so he doesn't care. Those assumptions are rarely, if ever, accurate. We can have those negative thoughts about ourselves. I'm unworthy. God is punishing me. My spouse would be better off with someone else. Those are the kinds of things that steal our peace. And insisting on handling it all alone. I'm keeping all of these emotions and thoughts to myself because people will think I'm a terrible person or I'm a bad Catholic or I am ungrateful. And so we don't reach out and ask for help. So how do we sort of counteract that? Communicate, express your feelings to your spouse, to your best friend, to your mom, to whoever is close to you that you can go to for support. Again, remembering that we all process differently. So cultivate generosity, especially with your spouse. It won't work all the time. You'll still fly off the handle or you'll shut down. But notice that, recognize that, and then make changes as you can. Mind your thoughts and be sure to distinguish between those lies that are from the devil and the truth. Jesus told us that the devil is a liar and a murderer from the beginning. But he also says that Jesus, is the way, the truth, and the life, and the truth will set us free. So distinguish those lies that come into your mind and say, I'd be a terrible mother, or my sinful past is catching up with me now and God is punishing me. That's the devil poking at you like the coals in a fire. He pokes at them because he wants that flame to just rise up and consume you. So mind your thoughts. And if it's getting to be too difficult for you, if you are finding that your sadness or conflict in your marriage is too much for you, seek help. There is no shame in seeking a mental health professional. You can contact us at Springs in the Desert, and we can put you in touch with resources to help you find a good Catholic or Christian therapist. The Archdiocese can help you. Your local Catholic charities can also be a good resource. So don't be afraid to seek that help. And then finally, creative. we can wonder if we're in a season of infertility, or if we're entering into menopause, if we're entering into that time where we're past childbearing years. Like, what does marriage even mean without kids? What's the purpose of it? Is there any purpose? And infertility, temporary or permanent, really does feel like a desert. And what is a desert? It's vast. It appears to be endless. It's dry. And it's a place where nothing grows. And when we feel like that, we can feel as if our marriage is lifeless and without purpose. But that is one of those lies of the devil. It is not true. So how can we counteract that and cultivate creativity in our marriages? Well, first of all, you were made to be life-giving. Each one of us is made to be life-giving. And we are life-giving right now. Whatever our season is, we are made to and can be and are fruitful. Your marriage is good. And it's a powerful witness to fidelity. All marriages are hard. All marriages deal with problems and crises that we could never imagine. But when you're dealing with this particular suffering, know that your marriage has great purpose and that it is a witness to fidelity, to persevering, even when the circumstances are so difficult. And that's a great witness to the rest of the world, especially these days where marriage is so undervalued, or we're confused about what marriage even means. And so infertility is hard, and I want to affirm that. But it can also bring us very special and unique gifts. And if that's hard for you to hear right now, that's okay. But that's something that the Lord can reveal to you down the line as you walk on this path. You can be creative by nourishing that domestic church. Create a church of your home. You and your husband, you and your wife are a family when you marry. And so your home is a place where the Lord dwells. If you can see behind me, I have icons. Encourage you to have icons or crucifixes or statues. You don't have to create a cathedral in your house. But those are more than just symbols. Those are signs that the Lord is the head of this household and that he has us under his wing, and that we believe that he is with us in our marriage. And the domestic church is a place to cultivate hospitality, which is so life-giving, to be able to be a place where so many people who are single or who are having difficulty with their own marriages or who are alone, you can be that refuge and that ear to listen and that shoulder to cry on, but also that place where they come to celebrate and to have fun and enjoy each other. So that's also very important. How you are creative and life-giving and fruitful right now is something for you to think about. And I could give you a whole bunch of hints. We had an experience just last week where our nephew had to bring his little girl to Hershey Medical Center for a follow-up to a surgery that she had. And he called me and asked me to take care of their littlest one. And I just pushed him around in the stroller, and we went to the park, and I held him and played with him. I'm radically available to do that. Yes, I want children of my own, but that radical availability to give myself in these situations, that is life-giving, that is fruitful. So don't sell those opportunities short. And it doesn't just have to be with regard to taking care of children. It can be the neighbor who needs some help, or people in your extended family. That creativity can come out in your professional life, in how you volunteer, in your parish, in so many ways. So I want to really encourage you to think about those many ways that you are fruitful and life-giving right now. And the last thing, sort of message that we want to leave you with is what Caroline alluded to, that infertility is a circumstance. It is not our identity. And in our ministry, we are very careful. And sometimes it turns into a mouthful when we say struggling with infertility or carrying the cross of infertility. We are not infertile women, infertile men, infertile couples. Maybe that's medical jargon that is used out there, but we are careful not to use that word in that way, because we know that that is not our identity. We are not infertile deserts, lifeless, purposeless places. We are meant to go out into the world and bring springs of life and creativity into it. And that creativity springs forth through our relationship with God and through the self-gift and relationship that we have with our spouse. So we want to thank you for this opportunity to share some time with us. And please do check out Springs in the Desert. We'd be really honored to walk with you. And Cassandra, do you want to put in a plug for our retreat?
Yes. If you enjoyed what you heard tonight, you're in luck because you can come and hear all about it in person. We are offering a day-long retreat for women in New Orleans, and you can register at springsofthedesert.org/NOLA. And we would love to see you there. All the information is there. It's on August 27th, and it should be a great day.
Thank you.
Thank you all. And if anybody has any questions that they want to ask or, put in the chat and I can read for them. If you want to direct message me, if you want to stay anonymous, that's fine. Or if you want to unmute yourself and ask, that's great too. So just either way is fine. I'll wait for whoever.
If we're waiting on any questions, I just wanted to say, please come and visit our website and just find out about all the things that we have, all the offerings we have. And I do want to shout out that I see some of our people here. You know who you are. I'm not going to name you, but it's really nice to see some of our people here.
Sarah, did you have a question?
Yeah, hi. So I'm actually a Creighton instructor also, and I'm a NAPRO PA in Arizona. So I really appreciate what you guys are doing, and everything you said is so valuable. So I'm wondering how to best get my patients plugged in with the ministry. Do you have more webinars coming up? I see you hold up the brochure.
Yeah, we can get you brochures if you, I'm going to put our email and we can connect with you.
What diocese are you in, Sarah?
So the Diocese of Phoenix. I see a picture of Cassie Durnan in all of your materials, and I actually know her. So it's great. I'm at Morning Star OBGYN in Gilbert, Arizona.
Awesome. Mike Phelan, who is the director of the Family Life Office, was actually my classmate in grad school at the GP2 Institute. So we would love to sort of get more involved there in Phoenix, but certainly email us. We can send you some brochures. And if you sign up on our website and subscribe, you will receive our monthly newsletter, and then you'll be able to see everything that's going on. We'll be doing some more virtual things, especially as we move into Advent. And then, in the spring, we'll have some more virtual events. So just watch our website and our socials.
Great. You can follow us on Instagram if you're not doing a cleanse.
Great. Yeah, I'm sure that maybe not the webinars. My patients would appreciate just the social media stuff, but it might be better for some to have something like this to actually connect with real people in real time.
Mm-hmm.
Thank you.
Caroline. Yes.
I'm just going to say, is that email the same for all of you? Because Antonia wanted to speak to Caroline. So if she wanted to reach out to her, could she just email that info at Springs in the Desert?
Yes, you can do that. And then I will go ahead and put you in touch with Caroline.
Great. Thanks.
Yeah.
So
There's
Antonia,
also-
if you're still on and you heard that, just email info@springsinthedesert. And that email that's in the chat there, and they'll be able to direct you to Caroline.
There's also on our contact page on our website, there's also a button for talking to a team member. So if anybody would like to just kind of talk to someone, and we can just do it over email, if you have questions or you just need some support, please feel free to do that, because we'd love to talk with you and walk along with you on this path.
Great. Thanks, Rachel.
We've had a couple people that have mentioned that they've got to go. So I don't know if everyone's all set and done with their questions. I'm sure if you have questions that you'd like to ask, you can definitely email them in the future or go to the website as they had mentioned. But I, on behalf of Liz and my team at the Family Life Office from the Archdiocese of Boston, would love to thank you for coming and sharing this with us. It was, very fruitful for us and for those, I'm sure, that were in attendance tonight. And we thank you for your ministry, for all the ways that you help women and couples who struggle in this way. And for all of you out there who do struggle, we are praying for you. And we know that God is using you in wonderful and amazing ways to accomplish his plan and purpose for this world. And I'm sure those ways are unforeseen now, but in the future, when you're a saint in heaven, you'll realize it and you'll know. And we're just praying for you, and we hope that you pray for us as well.
Thank you so much. Thanks, everybody. God bless you.
Thank you.
God bless everybody. Have a good night.
Good night.
Good night.